Nexus means convergence. Nexus means enhancing and harnessing synergies. And I think the biggest challenge is that we still think of silos, within silos. That's one lesson that I'm bringing home from Nexus, how to look at other sectors and harness these overlap.
I think for me the best thing is the consciousness towards realizing how climate change actually isn't only an environmental issue, but it's also a health issue. But now listening to all these experiences, you see that it's actually quite much of a health issue.
I'm most concerned about the fact that we have a range of toxic chemicals already in the environment, and climate change is making their impact worse by remobilizing them and making their toxicity even worse than they already are.
You cannot just develop for the sake of development. You have to understand that development has cost if you don't take care of the environment. We've seen all these developments in the first world, which unfortunately our developing countries try to emulate. They're using a lot of resources, but also generating a lot of pollution. And if you don't strike a balance, then at the end of the day, the development is not sustainable.
Climate change was identified by The Lancet in 2009 as one of the biggest threats to global public health this century. More recently, we've seen articles in the British Medical Journal saying that the World Health Organization should be calling climate change a global public health emergency.
Some of the things that we are most concerned about is the issue of the vulnerable populations in this whole climate change discourse. Because I think somewhere that gets lost. It is a global issue, of course, but it impacts the people within countries which are the most vulnerable, that depend so heavily on their environment and on natural resources for their everyday life. For example, the people that I work with, which are waste pickers, they are probably the most marginalized. They come from the lowest caste in India, and they're usually women. And because of all three of these conditions, their reliance on natural resources, because they're recyclers, and they can't do it if there were these huge changes in weather and climate.
Climate change is a major health threat, and climate solutions also are health solutions, and vice versa. Health solutions can be climate solutions. So when you switch from fossil fuel combustion to clean renewable energy, you're protecting local health in cities like Beijing or Sao Paulo or Johannesburg. And at the same time, you're reducing emissions and addressing climate change.
We come out of an environmental justice framework, and so meeting health professionals that are passionate about these issues, I want to see how can we get health professionals that are going to support us in this fight against the water shutoffs. How can we get health professionals in the Detroit Medical Center to help us with this fight against the incinerator? How can we get the public health industry to align with us in our environmental justice work that we're doing in Detroit? So I want to take this framework and really see how we can run with it.
I don't think this fight has ever been about pollution. This fight is about dignity. This is about justice. This is about the identity of communities. It's about protecting our cultures.
Primeiro temos que mudar nós, né? Temos que mudar o nosso hábito, a nossa forma de ver, a nossa forma de pensar, a nossa forma de olhar. Nós temos que olhar aquilo que nos é ofertado como uma coisa boa.
First of all, there's need to change the way we think. People should now review or revive their way of living, their cultural way of living, because we have some stories, although they are not written anyway, but we have stories from our own ancestors telling us how they've been living, how they've been producing food, good quality food, and they've never gone hungry.
I think what needs to change is that those in power need to hear how these effects are real, how these climate change effects, how the chemical contamination is affecting our children and our grandchildren, and that this is not just an abstract issue. This is a very real and present and very serious issue. And if we can reach the hearts and minds of decision makers and shift that power, I think we can create change, and joining with people from all over the world, as we're doing here, really matters.
I think change must come from us as well. It must always start with us. But individuals by themselves, I think it's not enough. So this university is a good example. I've been very impressed by what I've seen. But it's one university. And so if we want to change, if we want to bring change, we've got to look at how do we change systems. I think that's very important. How do we change ideas? How do we change people's perspectives? The values that govern our society.
I've been an activist for over 30 years, and I've seen communities brutally crucified, but I've also seen communities just stand up and say no more, and I've seen them win. And those small wins, every time you see a small win, then you think we can do it. And so it keeps me going. And I've got grandchildren. I want a lovely world to leave them. The same world that I've been able to experience. I don't want them to live in a toxic, contaminated world with climate change impacts all over their lives.